Hi, friends. I'm Scott Giles, and welcome to Power Talk, my podcast here on Facebook Live and YouTube. Every week, I cover topics related to spirituality, hypno-coaching, and the hypnotic arts and sciences generally. If you want to know more about my work professionally, please check out my website, which I'll tag at the end of this video. Today, I want to talk about the expression we've all heard of someone saying they're trusting their gut. Now, we've all heard that expression, or we've had the experience ourselves of just knowing what to do in the absence of clear evidence or data. Now, I suspect that what's going on at such times is more than just intuition. In traditional Chinese medicine, the gut is actually called the second brain. And if you think about it, the gut sort of does look like a brain, with crenellations and folds that mimic brain structure. And most of us have experience of things like GI upset when under bad stress, indicating that our gut does respond to what's happening in our emotions and in our environment. This was really brought home to me when I was training at the University of Chicago Medical Center. I've always been interested in cancer care as a clinical chaplain and community minister. I would ultimately go on to specialize in that, and probably hypnotic interventions into cancer is the thing I'm best known for as a consulting hypnotist. But while I was at the University of Chicago Medical Center, I had the opportunity to observe the behaviors of some of the very best oncologists in the world at that time. Now, my fantasy had been that they would be making decisions based on reams of data and empirical scientific observations. Uh-uh. Nope, not at all. In fact, I witnessed one oncologist working with two patients who had identical cancers at the identical stage, and that oncologist prescribed one system of chemo for one and a completely different family of chemotherapy drugs for the other. And he couldn't describe why he did that, but gave the "I'm trusting my gut" answer when asked. And it turned out he was right, and both patients did really well. But as time went on, it became obvious that he wasn't unique. Most of these people were playing hunches all the time. When I discussed this with my supervisor, he suggested that the physician was actually making decisions based on data that was below the level of consciousness, unconscious awareness. The patient smelled different or something. And my supervisor said, "You can't teach or quantify clinical wisdom, but it is very, very real." That's probably why, and the evidence on this is just absolutely convincing, that if you have a less than common medical problem, you are far, far better off going to a major medical center where they handle a lot of such cases than at a regional or community hospital, even if the surgeries are exactly the same and the drugs are given exactly the same and the standard of care is exactly the same in both locations. And the reason why you're better off going where they do a lot of this kind of case is that because of the economy of scale, the professionals at the major center have unconscious insights gleaned from the many patients they've seen, but they can't describe in clinical terms or scientific terms. So, to my way of thinking, trusting your gut means choosing to attend to unconscious wisdom, allowing information from background processing in the brain to emerge. Now, I'm a martial artist. I'm a second degree black belt in Taekwondo, and I was the instructor in ancient weaponry for my dojang for more than a decade. I fully understand the limitations of conscious processing, and any martial artist or fighter has that same insight. The reason martial artists and other fighters drill and drill patterns of response is so that when they're needed, you don't have to think about them. The actions are simply there in your mind, ready to be used. You can't think your way through a sparring match, because while you're trying to figure out rationally what to do next, your opponent will walk all over you. At such times, your gut instinct is all you have. It may be a well-prepared and rehearsed gut instinct, but information about what to do will not be coming from the conscious mind. Now, it's true that we don't understand what the unconscious mind actually is. But evidence is mounting that our minds are a process that emerges out of the activity of multiple organs in the body. Certainly, the brain appears to be the dominant processor in that system, but it also appears that some sort of information processing occurs in the spine, the heart, and the gut, with these modules sending information back and forth to each other by nerve interaction, biochemical processes, pressure, and even electromagnetic impulses. So when you trust your gut, there may indeed be a literal meaning to that. Your body organs may be computing information, and then you're made aware of it through this gut feeling. To use a computer analogy, our minds are not a mainframe computer where all processing happens in one location. Instead, our minds really appear to be a distributed processing network where information is processed and shared holographically among several processing centers located throughout the body. Mind-body interaction is not just a metaphor. Your mind and your body are intimately connected. Now, I see two issues with trusting your gut. First, when should you trust your gut? And two, when is that a bad idea? Because intuition is not infallible. Intuitive insights can be mistaken. Lots of people have gotten into trouble by trusting their gut instead of their mind. Go into any gambling casino and you'll see lots of people in lots of trouble because they trusted their gut about what cards were in the dealer's hand. So my rule about all of this is the old Cold War saying, trust but verify. I think the obvious time to trust your gut is when you have to make a decision, but you lack enough data or time to hammer out a fully considered rational plan. If action is needed and there is no time to ponder further, going with your gut makes sense, as there is a chance that it has information your conscious mind does not. There is nothing to check out further because all the odds are even. Another time might be when you just feel that emotional click, where the pieces of a puzzle fall into place and you see a pattern to events that had previously escaped you. In such times, there will probably be a step or two you can take to get further verification of what you think the pattern is. But provided that checks out, your gut is likely the way to go. But there are real dangers as well. Anxiety is sometimes said to be worry writ large. And I've seen people in the grip of runaway anxiety paralyze themselves because their gut tells them that everything is perilous. Similarly, I've seen people struggling with a paranoid disorder in emotional pain because their gut tells them that everyone's out to get them. Now, at such times, learning to ignore what your gut says is the way to happiness and effectiveness. But how do you tell such times apart from when your gut should be your friend to when your gut's leading you astray? And the answer to that, I think, is that the information from your gut, the hunches you feel, should be helping you to be more effective, not less. If your gut instinct is consistently making you unhappy, frightened, wrong, or unproductive, then it should be called into question. If your gut is not leading you to a good, productive place, then your gut instinct fails the verification test, and you should seek instruction in how to do a better job in attending to your environment. And naturally, I recommend seeing a good hypnotist. Those trained in cognitive behavioral therapy will recognize this counsel, well, not the hypnosis part, but to seek professional help, as there are times when all of us need to pay less attention to feelings and assumptions and more attention to rationally analyze what is happening around us. That said, your gut wisdom can be a rich source of help at times when you have to make a decision, but comprehensive data just isn't in place. Your gut instinct will not always be correct, but the evidence seems to favor that it often will be. So trust it, but verify. That would be my counsel. Hey, thank you for your time and attention today. I'll be back next week with another talk on a different subject, and I'd like to invite you to join me. It does help me if you let others know about my videos, so please like, share, and subscribe. If I can be of help to you, feel free to reach out through my email, my website, or my Patreon channel. Stay well and stay safe.